Thanks so much. So hi, everybody. My name's Anika Brown, and welcome to my presentation, Health and All Policies for Local Governments, Helping Planners Prioritize Their Community's Health. So I'd like to first start off by acknowledging that my practicum was completed on the traditional, ancestral, and unceded territory of the Snuneymuxw and Sunawas First Nations, and I'm really grateful to learn, live, work, and play on their land. I'd also like to thank Dr. Paul Hasselbeck for all of his mentorship and support throughout my entire practicum. Paul is the Central Islands Medical Health Officer for Island Health. I'd also like to thank Dr. Victoria Barr for her support and expertise throughout the practicum, as well as Courtney Simpson, JD, and Dr. Trevor Hancock for their expertise as well. Who's made well, thank you so much. Okay, so I'm going to start off with a question for you, and I want you to think about it in your head. I'm going to give you about 10 seconds. So what do you see when you look at this image? So when I see this image, I think about all the ways that the community could be optimized to improve health outcomes, such as through increased access to healthy foods, improved accessibility for pedestrians, increased access to green spaces and parks, increased access to public transportation, and increased access to active transportation. And the reason that I'm able to identify so many improvements is because I view the world through a health lens, just as many as you do. So because we look at things through a health lens, we know that our health is determined by a number of factors. And we also know that these factors are influenced by sectors beyond the healthcare system, and that each level of government has a really important role in these factors. Therefore, in order to improve population health outcomes, we support sectors, all levels of government, in incorporating a health lens into their decision-making process. So local governments are uniquely situated to support their communities to improved health outcomes because they influence people live, work, play, rest, grow, and age. However, the problem is that they do not always take this influence into account in their decision-making processes, which can lead to health impacts and missed opportunities for improving health. A potential solution to this problem is the incorporation of a health and all policies approach to decision making. So, health and all policies is defined as an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies, and avoids harmful health impacts in order to improve population health and health equity. While many countries have recognized the importance of health and all policies at the national or subnational level, its implementation at the local level has trailed behind. And this is due to a number of barriers which restrict local governments from utilizing a health and all policies approach. So these barriers include a lack of organizational structures which facilitate intersectoral collaboration, the fact that the benefits of health and all policies may take a long time to see and therefore not conducive to electoral cycles. Some professionals working within local governments may not feel that they have a responsibility for improving health outcomes. There's a lack of knowledge, resources, and evidence to support this type of initiative, and making the changes can be overwhelming. So the reason this project came to be was because Island Health wanted to be able to support local governments, and in particular city planners, in incorporating a health and all policies approach to their decision making. So for those of you who don't know, in general, planners are responsible for designating land use, designing transportation infrastructure, helping with growth plans, and designing social and community services. So Island Health is aware that they cannot control all of these barriers. However, what they can do is help with the supply of information to planners. Therefore, the goal for this project was to create a library of resources which planners could utilize to incorporate a health and all policies approach lens to their planning processes. In this way, a lack of resources will never restrict them from doing so. So first, in order to do this, I had to identify the dimensions of health framework, which would be explored throughout my project, and this was accomplished using an informal lit review and expert consultation. Second, I identified the health and all policies tools for planners and local governments, and this was accomplished using a literature review of the grey literature. Third, I performed a qualitative assessment of each resource that I identified, and then I reported on findings and identified gaps. So for step one, this was the dimensions of health framework that I came up with. And as I began to research resources, I realized that there are really two types of health and all policies toolkits out there. The first type are toolkits which are meant to incorporate a specific health lens into any policy, not one specific area. So for example, gender-based analysis, sustainability, rural, remote, and small, inclusivity, and equity. And the second type of toolkits are ones which are supposed to inject a health lens into a specific area of planning, such as neighborhood design or transportation. And so I was able to identify four main areas: healthy systems, healthy people, healthy societies, and healthy environments. And under each of these were different subcomponents. And I was able to identify over 100 resources. And for the purposes of this presentation, I'm just going to focus on equity ones. So, what is equity? Equity is defined as the fair distribution of opportunities, power, and resources to meet the needs of all people, regardless of age, ability, gender, culture, or background. And so, how is equity connected to health? Well, unfortunately, many people experience inequities based on their identities. Entire groups of people have limited access to opportunities simply because of their income, race, age, gender, religion, sexual orientation, or immigration status. This unfair distribution of opportunities keeps people and populations from accessing necessities like nutritious foods, education, fulfilling employment, and safe and secure housing. As many health outcomes are influenced by these factors, it is clear that social, economic, and environmental inequities lead to health inequities. So we know that housing is difficult for Canadians, right? But consider this: almost one third of seniors live in housing which fails to meet standards. Women represent two-thirds of people living with disabilities who have housing needs, and almost half of individuals living in low-income neighborhoods are racialized. Therefore, if we don't consider these factors when planning for housing, then our decision-making processes will be inequitable. So, an equity lens will ensure that planners consider the needs of all community members when designing communities, especially those who are marginalized or disadvantaged. Equitable communities ensure that everyone in the community has the same opportunities to participate and prosper. So this is how I conducted my analysis of the resources. So first, I assessed user friendliness. We wanted the planners to be able to incorporate these resources right away into their work. We also assessed whether the resource explicitly detailed the connection between equity and health. We assessed whether the resource was specifically written for planners and local governments. I assessed what type of evidence was used to inform the recommendation used in the resource. And I also looked at the economic argument to see if one was made. This is because health and health policies will often require a significant upfront investment for long-term rewards. So this is really important to gain political buy-in. And finally, we assessed the usefulness. So was the resource a how-to guide, or would planners have to consult additional literature in order to implement the recommendations? So for equity, I found 5 resources which met the inclusion criteria. And in general, they were pretty good, useful as primers, connecting equity and planning. And a couple of them provided specific examples of how to improve equity through planning, and therefore the recommendations were pretty implementable right away. And at least one of them was useful in establishing a system-wide commitment to equity, so maybe throughout the entire local government, not just planning. But there were cons as well. So there was limited resources available which were specific to planners. They were more specific to local governments. They often focused solely on socioeconomic deprivation and missed other inequities. And while an equity impact assessment tool was found, it was not specific to planners, and therefore its usefulness is limited by the depth of inquiry that the planners are able to do. A lack of connection between health and equity was found throughout many of them. So while they talk about equity, maybe in social terms, they forget to connect that then to health. And finally, there was a lack of information proving that any of these resources have actually been effective in improving equity. So typically, they're just providing suggestions of what to do, but haven't said that they've been successful in the past. So based on my findings, I have 5 recommendations for Island Health. The first is to collaborate. So if we're expecting other organizations to make time for us, then we need to make time for them as well. And this is really crucial for a health and all policies approach where collaboration is key. The next is to inform. So where the connections between health and equity are weak, we need to inform our partners of these connections and help strengthen them. The third is implement and evaluate. So health partners should work with planners to implement these resources into practice and then evaluate their effectiveness at decreasing inequities. This is a really important step as it'll help decrease that gap in the knowledge. The fourth is research and create. So health partners should be prepared to create new resources which are specific to planners. And then along that same line, number 5, synthesize and disseminate. It might be helpful to synthesize the information from these 5 documents into one cohesive document to then disseminate. It'll just help with the user friendliness among planners. So, in conclusion, as health professionals, we have to do a better job of creating resources to help our partners in other sectors prioritize health. We also have to be committed to supporting our partners in utilizing these resources. This is a two-way relationship, and we have to be prepared to do that. So, to support planners incorporate a health and all policies approach, health partners need to be prepared for long-term commitments, strong advocacy, and relationship building. Thank you so much, and I can take any questions.
Excellent. Thank you very much. That was, again, a fascinating talk. I'm going to ask one quick question around, if you like, the economic investment that might be required, and also sort of just how long, in terms, how long it would take to see a sort of some return on that investment.
Good questions. And so my project was quite comprehensive. And so if I can talk to some other areas, when we think about something like maybe trying to improve physical activity, that might be through building parks or increasing access to sidewalks, and those things. They have varying degrees in terms of how expensive they will be. But in terms of seeing long-term health impacts, I would assume it would also take at least a decade, like at least 10 years, to try and see these population level health impacts decreasing, because we're not really talking about that individual level. And that's probably something that's missing within the literature as well. As I was saying, not many of these have been implemented in practice. So there isn't really that, we can't really base it off of a sample, like, okay, this community did this, it cost this much, and then 10 years later they saw this impact. So it's definitely an area of research that needs to be improved upon.
Excellent. Thank you. I noticed that, Jacqueline, you have a question. So far away.
Hi, Anika. Thanks for your presentation. It's really great to see a couple of really good resources highlighted there. I'm curious, you mentioned the political buy-in and some resistance from community planners taking on that health role and kind of that siloed attitude. In any of those resources, did you come across like an alternative language or a phrasing that maybe would be less resistance provoking for some of these health planners who are worried that they're taking on the work of the health authority?
Yeah, that's a really good question. And when I spoke with planners, that's one of their main concerns, is that they're often being asked to do so much. And they're kind of like, oh gosh, I'm not prepared for this. Or, I want to do these things, but I don't have the resources or the time or the leadership support. And so when I was speaking to some planners, something I found was actually not calling it health and all policies, which is, the international term for it, but just talking about, increasing wellness or livability, which, we can be synonyms for health, but those are kind of terms that planners are used to. They're terms that they're familiar with. They're terms that they utilize in their everyday work as well. And so, continuing on with the project and actually working with planners and kind of emphasizing that, like, yes, this is about health, but it's also about increasing the livability of our communities, increasing the wellness among all people, whether that's health wellness or other forms of wellness as well.
Thank you.
Thank you.
Thanks,
Helen, you have a question. No, we can't hear you, Helen, at the moment. So I don't know if you can hear me, but all I can hear is a sort of a swishing in the background. So I don't know, Doug, if you've got any suggestions as to how we can connect. Yeah, so Helen, you're the next speaker, of course, too, but if you can put your question in the chat box.
Well, while we're waiting for Helen to do that, I have one quick question for Anika, if there's time.
Yes, there is.
Anika, that was an amazing presentation. Thank you so much. And I've been a big fan of your project for a while. one of the things I wanted to ask you was, what is the health authority, Island Health? What are they going to do now with what you've presented to them in terms of recommendations?
Yeah, so I mean, as you can all probably imagine, my practicum supervisor is very busy right now with COVID, and so kind of how this project wrapped up wasn't as we anticipated it. But something that happens with Island Health, and particularly with my supervisor, is he'll connect with local governments, and they'll come to him and they'll actually say, you know, we're redesigning a walkway. We want to know what we should do. We're planning for housing. What should we incorporate? And so being able to have people within the health authority, whether that's healthy built environment consultants or environmental health officers, have these resources available and be knowledgeable on them and be able to provide them to the planners and work in collaboration is probably where we see the next steps. The difficulty with that being is that these haven't been evaluated further than what I've done. So it is difficult, you know, in knowing what to advocate for when we haven't been able to really test these in practice. But I guess the only way we'll be able to test them is if we're working collaboratively with local government. So that's kind of where I see it going from here, maybe after COVID has, you know, stopped being on everyone's mind all the time.